Joining us is Dr. Heavenly Kimes, now candidate for Congress, District 13 here in Georgia. Dr. Kimes, thank you so much for being here with us.
Thank you for having me, Faith. Good
and
to
I
be
should
here
also
again.
say a cast of Bravo's Married to Medicine. Congratulations on the new season. We are going to get into that. But first, I want to ask you, when we spoke earlier, you had originally planned to run for the Georgia State House of Representatives District 93. This year, you decided to change that and run for Congress. What was the thinking behind that, and why did you decide to switch it up?
Absolutely. The big, beautiful bill. Point blank, period. The big, beautiful bill. When I was running for state, I knew that I could help with state things, things that I was already doing, helping with people that fall into benefits. But on the House level, the federal level, I can actually do more with my platform. I can actually speak up and speak out. When the big, beautiful bill passed, I was waiting for our congressman to say something, and we heard nothing from our congressman. And so I was thinking like, hey, how can I help? How can I use my platform for something greater? I did a poll. I found out that over 60% of the people did not even know who the congressman was. Mm-hmm. And then when I did a poll, before I even announced my candidacy, I was statistically tied at number 2 in the poll before I even announced. So I was like, you know what? I can make a big difference. I can speak up, speak loud, and actually come through for the people in my district.
And there are several people who are trying to unseat the incumbent here.
Absolutely.
Mr. David Scott, who we believe will be running for re-election.
Yes.
He is seeking re-election. A crowded field, several people who are elected officials, several who have not held elected office. You are one of those who have never held elected office. Why should voters choose you over candidates who have had this political experience?
I think that people are sick of politicians. I think they're sick of the same status quo. One thing that I can say is that I have been working in that community for over 25 years, living in that community. I've seen firsthand working with patients, the issues they're having with healthcare, and it is really heartbreaking, right? We talk one-on-one, people cannot afford their health care insurance. They cannot afford their prescriptions. And I say, you know what can I do to help my family, really my community, my patients, my family? I'm the only one on the ticket that can say that they've worked in the community for over 25 years building businesses, and the person that has lived there as well.
And you are a healthcare professional yourself. Mm-hmm. Obviously, given what we saw coming out of Congress during the government shutdown to where we are now with the Affordable Care Act measures not going to be, those health subsidies not going to be extended. What do you see, just from your point of view as a medical professional, what kind of impact are your patients going to see from that?
It is real out there. I actually have visited different places in our district, and I found that firsthand, I've seen people open up their medical bill, and it has gone from $750 all the way up to $3,200 overnight in January. That will be their premium. And what they're saying is they cannot pay it. They cannot afford it. So they're going to go without medical insurance. And I want to tell you this is going to flood the ERs. My husband worked in the ERs for years. So it's actually going to cost us more money and not less, because we can do things with prevention. They also leave out dental and mental health benefits. And I think they're so important. As a dentist, I see firsthand that we catch things first, and we actually can prevent a lot of things from happening through heart bacteremias, clogging in our arteries, strokes, all those things, right, can be prevented in the dental chair, but yet they negate to get us funding that we need, the funding that we need.
If you are elected to this office, do you have any ideas coming into Congress that can help people that are dealing with these high prices?
Absolutely. There's so many ideas out there. One of them is there is a mental health crisis in our community, right? Over 44% of the people that are in jail right now are not real criminals. They're actually having mental health issues, and it's becoming an epidemic. We've come up with ideas of actually doing two-way cameras so we can get a medical professional on the phone, a mental health professional on the phone, so we can de-escalate situations.
Instead of an officer.
Absolutely. Our officer is there just like they do two-way for the officer to show what he's doing. We can actually use that same technology to put a medical professional or mental health professional to de-escalate, assist the situation so that people can have a better outcome. You know, if they can de-escalate, get the people the help that they need right away, that's what we're here for.
How about for affordability and cost of care?
Absolutely. People in my district are hurting, and I've seen that firsthand. But for affordability, what we have to do is go back and we have to bring funds for the people that fall in between. Now, I will say over and over again, the small business is the heartbeat of the community, right? So the way we do that is actually helping small businesses cut through the red tape, get them the federal funding they need, the SBA loans and such, so they can create jobs, give them tax credits for creating jobs within the community. Listen, everybody here needs to be able to live with dignity in our community.
And that's a pretty moderate stance, too,
Yeah.
I'd say. Do you think you could reach across the aisle on that?
Absolutely. That's what I do. I don't know if you know, but I started my practice out in Clayton County, right? And from there, I grew to 9 practices. I have started and ran businesses all through this district, actually in every county of the district. So when I say that, I have negotiation skills. So I want to be somebody, yes, of course, to reach across the aisle and actually get things done. Not just talk about them, but actually get things done.
Because that's what some people have observed up in Washington. It kind of seems like this kind of like
It's a
east
chaos,
side, west
right.
side. If you don't stick with blue or red and you cross over, you're seen as a traitor on some issues. We know that this is not for every issue. But what is your thought on that? Would you go against the grain and cross over if need be?
Absolutely. If it's something that stood out to me that I cared about, absolutely, I would go against the grain. I think it's unfortunate that they can't come to agreement on pretty much anything, right? I think that's not what our government was designed to do. I think that yes, you have to reach across the aisle and work with everyone. Yes, absolutely.
I want to ask you just about, a lot of people who are maybe not too into politics. Mm-hmm. They know pop culture and they know you from Married to Medicine. Mm-hmm. You have been on the show for several seasons. 12. Mm-hmm. 12 seasons to be exact. You all just had a new season that came out this year. Mm-hmm. And within those episodes, I know that they were filmed before, I believe you made that change to switch over to Congress. So you were talking about, you were announcing to run for State House. But within those episodes, your castmate, Toya Bush Harris, she had some criticism for you during that. She said that you can't maintain your relationships in your friend group. She said that she thought that this was a joke and that the state representative wouldn't be you because you can't even hear the people. What is your response to Toya?
You know what? She has a very valid question there. I honestly view reality TV as entertainment. I think you see a small portion of someone, but not the whole portion. I think that I'm very passionate about the things I believe in, meaning family, my family, and the health care for people. So yeah, I am loud. I am maybe not polished. In fact, I'm gonna name my first book Unpolished. But I think that's absolutely what you need in Congress right now. Somebody that's not afraid to speak up, speak out, and answer the questions when they're even uncomfortable to answer.
Toya said that she would not vote for you. I'm sure there's others who say that they will not vote for you. What's your message to them?
My message to him, well, first of all, she can't vote for me, but I wanted to make sure that people know the difference between reality TV. I've actually been working in 9 practices for over 25 years. I feel like there is a side of me that is a professional as a doctor, because I've been a doctor way before that. I have a side of me that does reality TV, and I do that job very well as well, entertaining people. And then I have a side of me that will be a politician, that will be bold, that will be unbought, unafraid, and speak up and speak loudly for the people in District 13.
And reality TV stars have made a name for themselves in politics. Our president is one of them.
Absolutely.
He was on reality television. But how do you convince public perception that what they're seeing on Married to Medicine is not what they're going to get in Congress, or is that what they're going to get in Congress?
I think that people understand that long before reality TV, I'm a doctor. I've been a doctor for a very long time. I've actually built businesses from the ground up. I have negotiating skills. I'm able to do things and make things happen. I'm the only person in this district that can boast that I've lived here for over 25 years, but I've also created jobs in every county in this district. And there's something to be said for that. Yes, I'm bold. Yes, I'm loud. Yes, I'm unapologetic. And I think those are the things that we need in Congress right now. I think for now, our congressman has been silent. You have a draw in the sand. Do you want somebody to not speak up and speak out for you? Or do you want somebody that's a professional that lived the life? I'm a girl that grew up on food stamps, a girl that grew up on WIC, and I know what my constituents are going through right now. They're struggling struggling, right? And I want to speak loud, boldly, and I have passion in what I do and how I do it. And I think that's exactly what we need in Congress right now. Not someone that's silent, not someone that's going to be meek and meager and ask politely, somebody that's going to speak out, speak up for the people in District 13.
What's the number one thing you would want to speak up about if you're elected?
It has to be healthcare. Affordability actually encapsulates everything. Healthcare, affordability with housing, and you know, those eggs are very high. So affordability starting off, but of course healthcare. People are going to lose their healthcare insurance. And with the cracks in it, we've actually done extensive research on the Georgia pathway system. Nobody knows what's going on. They don't know how to get through it. So I'm coming up with roundtable discussions to come up with apps to walk people through that system. And not only that, a lot of mental health people cannot have the cognitive skills to actually work those 80 hours a month. So we have to actually come up with ideas that's just not a blanket that take over everybody, but actually deal with people individually, so everybody is covered and everybody's taken care of. And I'm very passionate about that.
Thank you for your answer. I want to ask you about one other thing that was brought up on the show, and it was in regards to your son, Damon.
Yes.
Earlier this year, he was indicted on a felony charge of aggravated assault against a law enforcement officer. According to prosecutors, in February of 2023, he drove his vehicle towards a Georgia State University officer. This is a family matter.
Absolutely.
It is now on the public stage just because of your role as a reality TV star. What is your message to those who look at this and say, you can't even keep your own house in order? How are you supposed to run part of the country?
I think that my son made a terrible mistake, but I think that there are a lot of things that people may not understand that was going on with him during that time. I love my son. He's a college-educated man. He made a mistake, but what I'm most proud of and most happy that the police officers did the right thing and my son came home safely to me. You know, and had he not been Dr. Damon Camp's son or Dr. Heavenly's son, it might have been different because police violence is one of the reasons that our boys don't come home. So I've given my son everything he can have. I cannot control what a man does. However, my heart goes out to my son for the things that he's going through. And I think the police officer did the right thing. And I'm happy that my son is alive because it could have went a whole nother way.
Do you think that your story can resonate with other people here in Georgia?
Absolutely. When they hear my whole story, yes, absolutely. Yes.
In relation to your son?
Absolutely.
And just kind of, you know,
yes, to hear the whole story, yes.
What is do you have time to tell?
It'll play out on Married to Medicine. Please tune in, Married to Medicine, Sunday nights at 9 p.m.
It'll come out on the show. Okay,
Yes.
thank you so much for that. My other question, because this is a big, reality TV is a big part of your life. If you are elected, would you be willing to step away from reality TV to serve in Congress?
Now listen, I leave all options open, but yes, Congress and actually helping my community is my first priority. It just is. I had to think about this long and in depth, and it is a sacrifice, but I think that it's worth it. I think that people need somebody that can speak up, that speak out, somebody who's lived these things, somebody who's grown up on assistance, public assistance, somebody who's gotten a student loan, somebody who's a two-time HBCU graduate that understands that those federal funds and the Pell Grant got me where I am today. And like I say over and over again, I'd be totally remiss not to look back at the people and help other people join what I've done. Meharry Medical College taught us to serve the underserved, and I took that as heart. And when I see a problem, I don't wallow and talk about it and complain. I step up to make a change in our community.
And just to clarify, so if you are elected, you're going to put a bow, at least temporarily, on Married to Medicine and reality TV?
We do not know. I do not know how that, but yes, my first priority would be my congressional seat when I win. And not only that, when I win, in May 19th, make sure you guys get out and vote for Dr. Heavenly, but when I win, I will continue to campaign to make sure we flip other seats, because ideally what has to happen is if we're in control on the Democratic Party, then we can really make some things happen. We can really change some laws and help some people, because people are really struggling right now.
Dr. Kimes, thank you so much for coming in. We truly appreciate the conversation, and we look forward to learning more on this season of Married to Medicine.
Thank you. I appreciate your time, Faith. Thank you.
Thank you.